Hey folks, this is going to be a really short, sharp video on assessing clinical practice guidelines, mainly because the really core examinable content is pretty slim, and so we'll really focus in on that. So with regards to clinical practice guidelines, basically the idea is you're a practitioner, right? You're a doctor. You want to be able to use evidence-based, medical practice, but you don't want to have to read 2,000 articles about bronchitis, for example. And so what you do is you instead rely on a group of people, usually a college or a hospital or some other organization like that, that will then go on and actually do the work for you. So they'll go and read all of those and they'll write it up, and they'll usually get specialists to do it. And that's what we call clinical practice guidelines. It's basically a guide for practitioners to say, if you have a patient with these symptoms and they're in this risk bracket, this is a good thing to do. And you might have come across a bunch of flowcharts for management of various conditions, and they're usually from these sort of guidelines. Okay, so you might have come across some of them from, for example, RACGP in Australian Family Physician. Those are quite good, and they're also quite good for ICLs and that sort of thing, if you guys are doing research. So really the important bit to understand about CPGs are the key elements here, because they do ask you questions like, which of these elements do clinical practice guidelines need to be valid, right? And so the most important bits of it here are the ones listed on the screen. So the Australian part of the guidelines applies for when you're talking about an Australian healthcare setting. So of course, if you're looking at an international perspective and something like public health, you might not need to look at Australian guidelines, but typically we try to stick to the Australian ones. So evidence-based, based on research. Current means that, they're not decades out of date, free to access, transparent. So basically you can see like they are very clear about how they put together their guidelines and how they chose what to recommend and what not to recommend. And then of course, you want to know it's coming from people you can trust and that they don't have ulterior motives. So again, we have, all the elements listed prior. They're really key to development, and those are the ones if you want to revise anything, you should be revising. But also we want to, involve patients. We want to make sure they adhere to patient-centered care. We want to make sure that they're really comprehensive and that they're, again, both very clear in how they put together their recommendations, how they present their recommendations, and how they are free from bias. So the really good ones, and like I said, the ones that are good for things like ICL, usually the ones from RACGP or Royal Children's Hospital. There's also a bunch of other organizations that put them out for various things. And the table over there is just an example of one from a clinical guideline of community-acquired pneumonia, which I believe is from RACGP. So yeah, really short and sharp. Make sure you revise these key elements because those are typically the ones they care about. So make sure you understand what goes into making a good clinical practice guideline. Thanks very much, and see you in the next video.